Hi, my name is Ryan Murphy. I'm a student physical therapist assistant from Jefferson State Community College, and today I'm going to be talking about RPE and aerobic exercise interventions. So you may ask, what is RPE and what does it stand for? It stands for the rate of perceived exertion and was created by a man named Gunnar Borg. So Gunnar Borg created this scale so that you can measure how an individual feels after performing an exercise or activity. It is a 20-point scale, but you commonly see it start at level 6, but it does go on to level 1. As you can see, level 6 is very blue compared to level 20, which is very red. For level 6, it means there's very little fatigue. They feel pretty good. It wasn't too much of an exercise, versus level 20, which is red, meaning it was very hard, they're very fatigued, and that exercise could have possibly been too much for them. The measurement of exertion, it can be determined by the individual based on the scale. Borg's RPE scale can also be multiplied by 10 to determine the patient's heart rate level during certain activities. With this scale, you as a PT and PTA are able to determine if an exercise is too much or too little for a patient. Aerobic exercises are important to your health. The American College of Sports Medicine states that between 20 to 60 minutes of aerobic exercise, about 3 to 5 times a week, is important when someone is trying to improve their cardiorespiratory fitness levels. When you're creating an aerobic exercise program, you need to keep in mind the 4 ideals of exercise. You need to keep in mind mode of exercise, intensity of exercise, the duration, and also the frequency of exercise. These, in correlation with the patient's heart rate levels, will create a good exercise program that adequately challenges the patient while also improving their functionality. So I'm going to explain to you what these 4 things mean. So the mode of the exercise just means that you want to keep the patient interested and kind of encourage them to want to do the exercise. So you want something they can do, because if it's something that they feel is difficult for them to do, they may be discouraged and not want to keep up with their program. You also want it to be enjoyable, that way they're intrigued by it, and you just want it to be within their functional realm, what you're trying to work on and imply with them. The intensity of the exercise is basically how hard are they going during an exercise and how much energy are they trying to use. This will be dependent on how much oxygen or O2 they're able to carry during the exercise within their bloodstream. With the patient's heart rate, it's important to know if they can carry the appropriate amount of O2, because if they are unable to carry the appropriate amount of oxygen, they could possibly fatigue very quickly and even faint if it's too hard of an exercise. The duration is how long are you asking the patient to perform this. This should be taken into consideration because you want the fitness level and the intensity of the exercise to be one and the same. If you give someone a high intensity exercise for a very long duration and they have a poor fitness level, you may over fatigue the patient or they could struggle to recuperate afterwards. The frequency of the exercise, how often would you like the patient to exercise or do that certain exercise? This should be determined by the correlation of duration, so how long it is, and the intensity, how hard are they going. Exercise less than 15 minutes should be performed between 2 to 3 times a day, but if the exercise is continuous, 20 minutes, you can perform it once a day. So what effect does aerobic exercise have on the body? Aerobic exercise can have an improvement on health and even possibly slow aging. There are many benefits to aerobic exercise that I'm going to explain to you. Symptoms of depression can be reduced through the release of endorphins that you commonly get when you exercise. Exercise may also be able to lower your blood pressure while at rest. So the more you exercise, the stronger your body gets, the less your heart needs to work for you, because you yourself can maintain a good, healthy blood pressure. You may also be able to decrease the risk of arteriosclerosis, which is the hardening of blood vessels due to a fatty buildup. So that's just kind of back in the realm of being healthy. You also can decrease the risk of osteoporosis just by maintaining a healthy lifestyle. And all of these advantages can be achieved just by walking for 30 minutes a day. So RPE and aerobic exercise. Borg's RPE scale in correlation with aerobic exercise interventions is useful in the creation of an aerobic exercise program. The RPE scale helps to monitor if the intensity is too high of an exercise and for the patient to handle. If the patient's not able to handle that intensity, you may have to modify or change the exercise. Simply explain the scale to the patient, show them how it works, and get them to perform multiple exercises. This way you can see if an intensity is too much or too little, or if they're unable to do a certain task. You will then get them to rate where on the scale they feel they are, whether that's a 6 or a 20, or even just in the middle. If you are unsure if they have rated themselves correctly, you can always check their heart rate and compare it back to the scale. And again, you can use their heart rate to get what their total heart rate would be in a very high intensity compared to just the scale also.